Hi, Corey Elliott here. I am the editor for the ALS research page on Facebook, and I just wanted to share with you my top 3 recommendations for prevention and treatment of ALS. What qualifies me to talk about neurological health and ALS specifically? I went to Western Washington University. That's where I graduated from. Now, I didn't graduate with a specific degree in brain sciences, but I did take a wide array of courses dealing with the brain, neuroanatomy, functions, sodium, potassium pumps, and it gave me a good foundation and understanding of the brain, and really stimulated in me a passion and a desire to continue my learning after I got out of school. So I continued. I read countless books, Dr. Amen, Dr. Blaylock, you name it, I read it because I wanted to figure out how I could optimize my brain function and also help the people that I know optimize their brain function and have the best life they can. Then we get to my aunt's story. About 3.5 years ago, she was diagnosed with ALS. She's a very important, influential, inspiring person in my life. And I was in a point in my life where I could come in and caregive for her. So when she got diagnosed, I came in part-time and helped her. And as the disease progressed, I worked more and more into a full-time role. And towards the end, we had to bring in more family and even some home care nurses to help her be at home, because that's really where she wanted to be. And she passed away about a month ago. So that's one of the reasons why I'm really inspired to continue and help other people understand ALS, especially from a neurological standpoint. So when I found out she got the disease, I refocused my attention from kind of a broader spectrum of brain and brain science to specifically ALS. All the stories I heard were, we don't know what causes this disease. There's not really much we can do about it. I didn't really believe that, and I started to do my own research, dig deep, find doctors and scientists and institutions that were getting some answers, and I did. Now, is modern medicine and your regular doctors and hospitals and clinics able to deal with this? I dealt with Virginia Mason and the ALS clinic there. Great people, well-intentioned, well-meaning. Unfortunately, not much they can do other than help symptoms and help provide resources to make things easier as the disease progresses. So, unfortunately, they're not really equipped to handle ALS. But I found some research that I think can help you. And so let's go ahead and get into that. First, I would say cannabinoids. One of the first things that I was surprised about when I began my initial research was that there was research being done at the University of Washington, which is right in my backyard. I live in Seattle. They were studying, Dr. Gary Carter at the University of Washington was studying cannabinoids, the active ingredient in cannabis, more commonly known as marijuana, in regards to how it interacted with ALS in animal studies. And they found some tremendous things. Anti-inflammatory, antioxidant, it has neurotrophic factors, which mean they go in and they help protect existing neurons. And neurogenesis, which is birth of new brain cells. Cannabis stimulates the birth of new brain cells, which is exactly what you would need, because in ALS you see the motor neurons dying. So I won't get into too much the specifics right here, but cannabis is an amazing plant that can help with this disease in particular. I'll go into more detail in some later videos. So, and also, I would also recommend that you check out Kathy Jordan's story on YouTube. She's posted a few videos on ALS and her She was about 2 years in. She started using cannabis, noticed some incredible results, kept using it on a daily basis, and I believe she's still alive. She was, you know, in her 24th year, amazingly, and just an amazing story. So there's a case study there for you of a woman with ALS who actually had profound results. All right, number 2, toxic metals. Mercury. You see, mercury makes up 50% of dental amalgams. Now that is something that you know, a lot of dentists back in the day didn't think would get into your system, but what they find out now is when you eat, you know, chewing, just general movement in your mouth, these amalgams off gas, and they off gas mercury directly into the tissues, and it has easy access into the brain. There are a few case studies from Sweden that I found in the Journal of Risk and Safety in Medicine. I posted that on the site. You can check it out in one of the links below. So, but one of the case studies was a woman recovered completely from ALS after proper removal of the dental amalgams. So that was crazy news to me. And so the key is, watch out for mercury. You know, can come from amalgams, can come from other places as well. Another thing we find is aluminum. Aluminum in the cells of a ALS mouse is in high quantity in the brain cells, in the motor cortex. And what we see also is a decreased amount of magnesium than we would normally see. So we see an increase of aluminum and a decrease of magnesium. That leads to the toxic, that is one of the toxic contributing factors to ALS. And then there's other metals too. These are the 2 I want to talk about now, just to keep it simple. And also, when you combine multiple metals, it creates a synergy of harm, where it's not just the sum of the parts, it's a multiplying effect that you see. So really important to see where these toxins are in your specific environment and see what you can do to get them out of your environment. Alright, finally, diet. Diet is so important, and this is one of the things that really kind of frustrated me, was there was kind of a lack of real dietary guidance from the ALS clinic. They would talk about protein and some of the macronutrients, but they didn't get into the micronutrients and how important antioxidants were and which specific antioxidants we should be eating. So here's some of my favorites, and I will go into more depth in some later videos. But add magnesium. Magnesium is so important. It helps keep the brain calm, and so the neurons don't fire uncontrollably, especially in the motor cortex, and that's why magnesium is so important. E, C, the B vitamins. The last one is alpha-lipoic acid. That's a supplement that when you take it, it goes in and it regenerates some of your other antioxidants in your system, especially vitamin C. Don'ts. Stay away from MSG. Monosodium glutamate. It's a flavor enhancer, food additive. It's known by some other names which the food industry uses to make sure that you don't know you're eating MSG. One of them is hydrolyzed vegetable protein. So be careful of that, and try to stay away from that as much as you can. Aspartame, NutraSweet, basically. It is also harmful to the brain. It excites the brain and causes the brain cells to fire uncontrollably. Genetically modified organisms. There's a lot of research going on right now which talks about how it's inflammatory. It can go in and do harm in multiple areas. So I would just recommend staying away from GMOs. So these are my top 3. Number 1, cannabinoids. You know, if you have it, it's the #1 therapy I would use. Right now, doctors prescribe Rilotec. Rilotec is an anti-glutamate. That is one of the things that cannabis does, is it's an anti-glutamate, but it also has a whole host of other positive benefits. Number 2, stay away from those toxic metals. My top 2 are mercury and aluminum, and we see they come from various places. And number 3, diet. watch your diet, get some of those supplements, and it will help with your treatment or prevention of ALS. So thank you for listening, and I look forward to talking to you again soon.